Hello everyone, this is Internal Medicine Theory. My name is Ali. Today we will talk about internal medicine and history taking. Okay, so first of all, let's understand what is internal medicine. Internal medicine is the scientific discipline or the scientific branch that involving the study, diagnosis, and the treatment with the observation of non-surgical diseases. Okay, not including any dermatological or neurological disorders. But before going further, we should understand specific terms. Number one, what is symptom? Symptom is what the patient tells you, okay, is the patient complains. For example, chest pain, I have shortness of breath, muscle weakness. Doctor, I feel feverish for the last 2 days. These all considered symptoms. So what is signs? Signs it's the doctor observation, okay? It's any abnormal change that a doctor can notice by any kind of examination. For example, edema, hepatomegaly, which is enlargement of the liver, by palpation, jugular vein distinction, as you can see in this picture, you can see how it's distincted, okay, by inspection. Next, let's talk about syndrome. What is syndrome? Look here. Okay, syndrome is the common cause of symptoms and signs, or it's the combination of symptoms and signs, which is form the clinical picture. For example, dyspnea, hepatomegaly, and pitting edema, which swelling of the leg. These are symptoms and signs of congestive heart failure. All of this will come together and form disease. What is disease? Disease is destructive process of any morbid change that lead to interruption of organ, system, or multisystemic dysfunction. Okay? Next, diagnosis. How can we write the correct and the appropriate diagnosis? Step number one, it's electing. What do we should elect? We elect the patient data, clinical features, and findings of investigations. How can we elect them? By simple methods. History taking, physical examination, paraclinical measurement, and investigation. Examples of physical examination: inspection, palpation, percussion, auscultation as known, paraclinical measurements, blood pressure, heart rate, respiratory rate, temperature, etc. Investigation, it depends on the system that we are observing. For example, CBC, X-ray, MRI, urine analysis, etc., etc. Next step, it's assessment. In this step, we take the whole data that we already elect from the first step and we assess them, okay? After that, we go to the third step, which is diagnosis writing. We already have all the data. We already have all the results from step 1 and step 2. Now we just put them in one line, okay, which is diagnosis. We take symptoms, signs, syndromes with the evaluated results of diagnostic tests and the knowledge of the disease and write the diagnosis. Okay, so first of all, we will start with today, it's history taking. History taking, it's very, very important step. It is the first interaction between the doctor and the patient. It is the interview or the conversation of the patient to gather as much as possible data that will help us write the final diagnosis. There are two goals when we're talking about history taking. We have medical goals, which are translation of symptoms and signs into diagnosis, and the assessment of stability or any change in known condition. That's the medical goal. But we have another goal, which is social goal, establishing a relationship and measure the trust. Okay? Next, history taking steps, simple steps. We have A, P3, maftosa. We start one by talking what are these. Okay, so the A, it's extend to official anamnesis. The P3, there are 3 Ps, P1, P2, P3. P1, it's presenting complaints, past medical history, and personal history. Next, the M, it's the medical history, MEDEX, allergy history, family history, travel history, occupation history, social, and you ask at the end, anything else? Okay, next. First of all, official anamnesis. What are they? Official anamnesis. First of all, we write at the very top of the chart date and time of history taking. Name. Name is very important. Name and gender, they are very, very important. They are two very important. Name to be familiar with the patient and for sex identification. Next, the gender. Gender is it's very, very important to be identified because there are diseases that are common in male and there are diseases that are common in female. For example, in female, we have systemic lupus erythematosus, myxoderma, thyrotoxicosis, and they are common in male, ischemic heart disease, hemophilia, etc. Next, the age. For the age, it's also important to know because also there is a disease that are common in children and there is diseases that are common in adult patients. Next, occupation. Occupation, it's also very important to understand the nature of the disease because for lead workers, they are common to have anemia, nephropathy, and peripheral nephropathy, neuropathy. Glass workers, they are common to be with silicosis, okay, asbestosis. Medical stuff, patients, with infection, X-ray radiation, bone marrow abnormalities, okay? Next, date of admission, source of arrival. Source of arrival if the patient comes to you by himself or herself, by an ambulance, sent it by a clinic or polyclinic. Next, we have the presenting complaints. What are they? The presenting complaints reflects the main disease, why the patient came to the hospital, okay? The main cause that brought the patient to the hospital. The mnemonic for presenting complaints are two. First one, it is for pain assessments. We have the sites. Site, you ask where. Next, we have the onset, subtly, gradually, and when did it start? The character, very, very important. You should ask about dull, ache, compression, sharp, radiation, okay? Does the pain radiate to any part of the body? Associated symptoms, for example. Okay, with that chest pain, did you have any nausea, vomiting, headache, dizziness, etc.? Timing, it's very, very important, and the frequency also. Exacerbating and relieving factors. You should ask the patient, what kind of thing that worsens the condition and what kind of things that relieve it? Okay, severity or the score, this is the pain scale from no pain, which is 0, to the worst at all, which is 10. Next, let's talk about for other symptoms assessment. Okay, we have Udbara. The first one, actually, it's called Socrates. Site, onset, character, radiation, associated symptoms, timing, exacerbating severity. And here we have Udbara, onset, subtly, gradually, duration, progression, aggravating, relieving, associated symptoms, and very, very important, ask always, is this the first time you have experienced these syndromes or it's not? Next, let's talk about an example of evaluation of chief complaints or presenting complaints in, for example, in angina pectoris. A pain is localized, okay, retrosternally. You have this is the sternum. The pain should be behind the sternum, okay? Your patient will point you like that, okay? In the center, palm size, okay? Which radiates to left scapula, shoulder, and jaw. Character, compressing, burning, list 2 to 10 minutes, provoked by physical exertion, relieved by wrist nitroglycerin tablets, among other associated symptoms, breathlessness, weakness, dizziness, nausea, palpitation, and anxiety. Next example, we have chief complaints in gastric ulcer, upper abdominal pain. Okay, upper abdominal pain or epigastric pain in this region, directly under the xiphoid process or here. Okay, no radiation pain appear on empty stomach, relieved by taking antacid, among other associated symptoms, nausea, vomiting, and sometimes headache. Okay, third of all, past medical history. In past medical history, ask an open question. Do you have any medical condition? What kind of medical condition? Treated it or not? Okay, next, you should ask about, have you ever been admitted to the hospital? Very, very important question. When? Why? Okay, these open questions. Third of all, have you ever gone through any operation? What kind of operation? When? Any associated complication during that operation? If yes, yes, talk about that complication. If no, move on. Okay, during the past medical history conversation, you should ask about any chronic diseases. Okay, you ask about diabetes, rheumatic fever, jaundice, hypercholesterolemia if your patient is old, hypertension, angina, myocardial infarction, strokes, asthma, tuberculosis, cancer, epilepsy or seizures, anesthetic abnormalities or problems, blood transfusion. If your patient have blood transfused, you should ask about the amount, the cause, and when. Okay? Let's move on. Okay, next, let's talk about personal history. Personal history, ask about personal questions, okay? But before that, you should ask your patient, it's okay or not. Please, always, okay or not to ask these questions, okay? Because some patients are sensitive. Is there any chance of using recreational drugs? And you ask for how long? And you ask what kind? Okay? Next, sexual history. We ask if the patient is sexually active, if his partner male or female. We ask about a history of sexual transmitted diseases, if they have been tested for HIV. These two things, okay? It's very important. Next, we talk about medication history. Take a little bit of time here because this is very, very important part. Ask your patient open question. Are you taking any regular medication? The name of the medication, how long, and the dose. Okay, for example, your patient is a 57-year-old male who had MI 2 years ago, and now he's taking aspirin, clopidogrel, both of them 75 milligram once a day. Okay? Next, are you taking any over-the-counter medication? Okay, and I wrote here homie, I don't know why, but okay. Next, are you on any type of contraceptive? And ask about hormonal medication. These are for female patients, for female in reproductive age, and for female who in menopause. Next, note to ask for pregnant patients. Ask about pregnancy, ask about menstrual cycle, ask about obstetrical history. Very, very, very important, okay? To gather as much as you can information. Next, allergy history. What kind of question? Are you allergic to any food, medication? Just write it down there. Next, family history. It's also very, very important. Take your time here to ask about his ancestors, if they had heart problems, hypertension, diabetes, asthma, etc. Travel history. Travel history is always associated with infection. Okay? Have you ever traveled abroad recently? If yes, where is it? Okay? Next, occupation. What do you do for a living? Okay? In occupation, it's very, very important. Why we ask about occupation? For example, for a patient with high status, the common diseases are ischemic heart disease, stress, okay, hypertension. For low status, we think about malnutrition and infections. Okay? Next, social history. In social history, we ask simple questions. Where do you live? Whom do you live with? Okay? We ask, do you work independently? Okay, this specific question is for elderly patients or patients with disabilities. Do you feel stress? Are you married? Do you have any children? The next important question, do you smoke? And when the patient tell you yes, we ask about number of cigarettes, okay? And then we take the smoking index, which is, here we have, smoking index, which is equal to number of cigarettes divided by the day and duration. Day and duration, okay? Mild, which is less than 100, moderate, it's 100 to 400, and you have heavy smoker, which is more than 400, okay? That's number one. Next, we talk about alcohol, okay? About alcohol, we should ask the patients amount per day. Ask always amount per day, okay? Amount per day. Always remember 10 grams of alcohol are equal to 30 ml of whiskey, also equal to 100 ml of wine, which is equal to 250 ml of beer. Okay, for example, male consumes 21 units per week and female consumes more than 14 units per week. That's just an example. Okay. At the end, we ask about others. If there is anything else would you like to ask the patient about? And ask the patient also about any concerns. And that's it. At the end, let's talk about the summary. First of all, you say, hello, just right here. Hello. Okay, grade your patients. Okay, shake his hand. Make a trustful relationship. Okay? Dive into the history, official anamnesis, complaints, past medical history, medication, family, what else? Then go to examination, go to investigation, diagnosis, and treatment. That was the end of our video. Thank you very much.